is no excuse, quite frankly. This is the time to get vaccinated. And for parents and caregivers who may have questions, I urge you to consult with your local physician or doctor to get more information. A return to in-person learning is instrumental, as you know, to the social and academic well-being and mental health of our students. As you know, together we can have a safe and successful return to school this academic year, and we need everybody to pull ahead as a team. Thank you so much.
We've been supporting districts throughout the summer with reopening plans that include expanded COVID-19 testing programs to ensure safety, expanding access to vaccinations for employees, students, and community members, and also summer learning and acceleration to ensure that we're catching our students up and supporting other needs that they may have, and also coming up with a plan for independent study in light of new legislation that requires districts to offer independent study for families that feel they're not ready to send their children back to school. The majority of our students and families are saying they want to come back to in-person instruction. We only have about 5 to 6% of families that have asked for independent studies so that their children can continue to learn remotely, but the majority of our districts and our students are saying they're ready to come back to in-person instruction. We work very, very closely with the Department of Public Health and follow their guidance and recommendations, but I am really pleased to say that there's been very little spread of COVID within schools, and that's because school leaders, teachers, pretty much everybody that works on a school site has done an amazing job of really implementing these mitigation strategies to prevent the spread of COVID. Over 80% of educators have been fully vaccinated, so that's really good to know. And we've offered opportunities for vaccines for both students and employees, as well as COVID-19 testing, which is another strategy that schools will be using to make sure that there isn't a spread of COVID.
Currently, we are unfortunately seeing a high rate of transmission. We were previously in an area of low transmission, but our case rates have now gone to a level, if you look at the CDC guidance, we're actually experiencing high levels of transmission. So we've administered almost 11 million doses of COVID-19 vaccinations in Los Angeles County. The big question I often get is when we can expect our children 5 to 12 or 5 to 11 to get authorization for vaccinations as well. At this point, for the pediatric vaccine, we are still assessing safety, immunogenicity, and implementation. So it might take several months until we get this emergency use authorization for our 5 to 11-year-olds. And then after that, it would be for the 6 months to 5-year-olds. Briefly, I do want to mention that we do have guidance on keeping schools safe. The tenets of infection prevention are to vaccinate if you're eligible, to continue to mask indoors, to try to be in areas with improved ventilation, to stay home if you're sick and to get tested for COVID-19. If you are infected with COVID-19, to stay home, and then to make sure your close contacts are aware and that they're able to quarantine. There is a lot of information suggesting that schools can be one of the safest locations as far as COVID-19 transmission goes, because our children trust their teachers and they listen to their teachers. And so if we were hoping that in the fall, these different strategies we have will work together to keep our schools safe and our children safe.
We have to prepare our children. That's the main thing. They need to understand that it would be different. It will be a hybrid schedule. The stakes will be low. Masks will be worn indoor by all individuals 2 years and older who are not fully vaccinated. And there should be consistent and correct mask use by people who are not fully vaccinated. The CDC is requiring 3 feet of physical distance between students within the classrooms.
What do you think the best news is that we can offer parents about reopening the schools for the safety of the school children, staff, teachers, and wider community.
That schools are one of the safest places children can be to prevent getting sick and to prevent getting COVID. Schools have done an excellent job of preventing the spread of COVID by using all the mitigation strategies, and will continue to do that because the health and safety and well-being of our students and our employees is a #1 priority.
Know that this fall will require it to be a joint effort between teachers, staff, parents, students. And the good news here is that we know this virus well. We have an effective toolkit. We know we could fight this transmission of this virus using vaccinations, masking when you're indoors, and then isolating and quarantining if you're not feeling well or if you've been exposed to someone who has been infected. And I think that these strategies together will work to create this healthy and safe school environment for our children.
Let's get back to in-school learning. Let's get vaccinated together.